Welcome to part 2 of Breast Cancer Month on, what do you call this? Surgery? Not surgery, but alternative.
We did surgery. Will be other therapies: chemotherapy, hormone therapy, radiation therapy. So the other things that people can expect to experience once they've gotten a diagnosis of breast cancer.
Well, this is Senior Mo with Nurse Linda. This is Dr. Charles Campbell behind the counter. This is actually a desk, but behind the curtain. And this is Nurse Linda. And this is very important. I learned a great deal in segment 1 on surgery. And I'm looking forward to segment 3 on all new stuff.
Yes.
Surgery. So take it away.
Okay. There are many times your doctor is going to want to provide multiple types of therapies for your cancer. This is all dependent upon stage, degree, your age, your other medical diagnoses. Can you tolerate surgery? Can you tolerate chemotherapy? Can you tolerate a combination of the three? Sometimes chemotherapy comes first, then radiation, then cancer, sometimes then other treatments. Sometimes surgery will come first, then chemotherapy. Your doctor will outline that for you based on your particular circumstances. But chemotherapy, in general, is a method of delivering medication dependent upon the type of cancer, the stage, and your goals for treatment. It is generally a treatment that uses drugs to stop the growth or kill the cancer cells. And they do that in a very interesting way. These medications can be given orally, they can be given intravenously, they can be given regionally. And what that means is they can actually give chemotherapy to a certain area of the body without affecting the entire body. So again, it depends on your stage of disease. There's many side effects that can be experienced with chemotherapy, but they are managed well these days. You don't have people vomiting everywhere like they used to. Okay, there was a movie that came out about 15 years ago, 20 years ago. A woman was, as soon as she got her chemotherapy, she had her head in a bucket. It doesn't happen that often anymore. Some people are very sensitive to the medication, but they've also developed wonderful medications to prevent that from occurring. Some side effects you can expect with any cancer treatment will be fatigue. It's the biggest limiting factor for most people receiving chemotherapy treatments. Again, accept the fact that you're going to be tired, and I'm talking profoundly tired. You're going to need to develop a support system, and this is very important when you're going into treatment. Your blood counts are going to drop. There's also medications they can give you to prevent those from going down too low and exposing you to other infection. So a lot of supportive things in place. Another treatment they can provide for you is radiation therapy. The radiation therapy is a high energy X-ray. And again, this will either kill or stop the cell growth. You can get it either externally by something called a LINAC.
A what?
LINAC. It's a linear accelerator. It's the type of machine that they use. They can also use cobalt. They don't use that as often anymore. Cobalt used to be the primary treatment for external radiation, and it left people with severe burns.
That's why they put it in bombs.
Yes, they don't use that often anymore. They'll use it if a tumor is very surfacey, like very close to the skin, but as a rule, they won't use that. There's better things out there. They can also do internal radiation, where they actually implant little radioactive seeds right into the tumor. And that is very beneficial because now you're getting a smaller dose to a smaller area, and it's killing the cancer cells. And then sometimes they remove the seeds, sometimes they don't, because radiation only has a specific lifespan. The treatment will be chosen dependent upon, again, the type of cancer, the stage of cancer, and your treatment goals. All of that comes into play. Then they have hormonal therapy. Now, hormones, we've learned over the years, are not always a good thing for cancers. Some cancers are hormonally driven, and that includes breast cancer, ovarian cancer, uterine cancer, and prostate cancer. So with a cancer that is hormonally receptive, they want to give you something to block those receptors. Now, they can go in, if you have a hormonally driven cancer, breast cancer, and remove your ovaries. That will stop a bunch of hormones right there. But there's other things in your body that give off hormones, so they may want to give you medication to block that. If you have an estrogen-driven tumor, they're going to want to block the estrogen. It's usually done with pills, and they'll keep you on something for a long time, and a lot of people are familiar with the tamoxifen is one of the most common ones, and they've learned, again, through clinical research, you go on tamoxifen, you only go on it for a certain number of years, then they want to switch you off to another hormone receptor inhibitor. And there's a number of them out there. Aromatase inhibitor is one, and it blocks the estrogen. But they're going to test your cells to determine if you have one of these types of cancers. They don't automatically assume that you do. And it's controversial. It needs to be discussed with your doctor. And again, the risks and benefits need to be evaluated. What is your age? What is your family history? All of those things go into determining which treatment is best for you and which combination of treatments is best for you.
Is hereditary involved in breast cancer?
Absolutely. Not 100% of the time, but many times it is. So if you have direct family members who have a history of breast cancer, even male members that have a history of prostate cancer, it's very important. And prostate, breast, ovarian, and uterine may all be related. So again, it's important to discuss your family history with your doctor to determine your best approach and what risk is there for future generations and what screening they should undergo, your children, your grandchildren, etc.
So there is a risk. Now on prostate cancer.
Mm-hmm.
Okay, how do you get that?
Same thing, it's as we age, and we may need to discuss that next week, exactly what causes cancer, how cancer forms. And that in and of itself, I think, is going to be at least one segment to understand that.
Now, do we have more cancer today than we had 50 years ago? Or is it just better detection?
There's better detection, and that's one of the things they've learned about with some cancers. Sometimes it's best to diagnose and watch. Don't do anything.
Prostate cancer is like that, isn't it?
Prostate cancer is one of the big ones that they're learning most of about that sometimes prostate cancers don't turn into anything because they're growing so slowly. It's becoming accepted as part of the normal aging process. So many times they won't do anything for someone with prostate cancer except watch.
I read that.
Yes.
Interesting. What's part 3 about?
Part 3, we're going to talk about some of the newer therapies and some complementary therapies.
Complementary?
Just a little bit. We're going to do more of those next week. We're going to talk a little bit about clinical trials, high-dose chemotherapy with stem cell, and targeted therapy.
Well, you've been listening to a very interesting discussion on alternative cancer treatments. Mm-hmm. And coming up, we'll be talking about the new stuff.
Yes.
On Senior Moment with Nurse Linda. Stick around, folks, and watch this. You need to.